10 milligrams or less. Yeah. And disease-modifying agents were continued with rituximab if they were needed to continue. There were some patients who were totally off disease-modifying agents once they received rituximab, but there were others whose dose was decreased, and there were others who continued the same dose of disease-modifying agents, but their disease was controlled, which wasn't controlled before the study drug.
So the
Hope it
disease
answers your
modifying,
question.
yeah, that's fine. I think Dr. Gibson had a question.
Professor Nikit, thank you very much for a very nice presentation. I'm a cardiologist, and my concern is that in patients with rheumatoid arthritis, you have a lot of complications as far as valvular heart disease is concerned. You can get pericardial effusion, cardiomyopathies in these patients. Is there some kind of a caution in these patients to use rituximab, like for example arrhythmias which can occur as a result of this?
Okay, the question is, does rituximab have any side effects of like arrhythmias in patients with pre-existing heart conditions?
As far as anti-TNFs were concerned, there are warnings for the use in congestive heart failure. Usually rheumatoid arthritis does affect the myocardium, but it is very rare to have like a cardiomyopathy due to rheumatoid arthritis. So it hasn't, in our patients, we didn't notice any cardiac rhythm abnormalities. And in the literature also, although with any TNF or with any agent, cardiac abnormalities are mentioned, but they are not like contraindications if the patients are not in class 3 or class 4 heart failure. That's for anti-TNFs. G, anti-TNFs also, more so in anti-TNFs,
The
but
box
with
warning is more for
rituximab,
anti-TNF.
for anti-TNFs, but for rituximab, not
Rituximab
really.
is not an anti-TNF, it's an anti-B. There is a, sorry, I think Dr. Gibson had a question as well.
Nico, thank you very much. All the questions seem to be directed at you, but I was curious to see that 95% of your patients were seropositive, and you didn't emphasize the value of knowing whether a patient is seropositive or not, because we know that the responsiveness to rituximab is dependent upon the presence of rheumatoid factor.